It's Health Tuesday, and on the show we have my favorite doctor of the moment, Dr. Remilekun Durojaiye. Now we're talking today about stroke. Does a stroke patient return to his normal life with physiotherapy? Now, Dr. Remilekun is a physiotherapist with over 33 years of experience, the clinical director for Special Olympics Fun Fitness Nigeria, and the physiotherapy screening arm of the Healthy Athletes program. It's great to have you, Doctor. You are welcome.
Thank you. Good morning.
Yeah, good morning. Now, this is one that resonates with me because I've had people around me who have suffered strokes in different mild ones, major ones, and all of that, you know. But before we go into talking about if a patient with stroke can recover, why stroke? How does stroke come? How can it be prevented or prevented? What is stroke?
Okay, in a nutshell, it's basically, they call it a cardiovascular accident, which means the blood that goes to the brain is interrupted for some reason. There are different causes of strokes. You can have an ischemic stroke where part of the brain dies because of lack of blood flow. You can have a brain bleed, which is like a hemorrhoid type of stroke. And you also have what they call mini strokes, like a trans-ischemic attack. So some people have very mild symptoms. Sometimes they don't even realize they've had it. So those are the main, basically a stroke is the blood to the brain is interrupted.
It's interrupted.
For some reason or other.
For some reason. Can we have an overview of maybe the kind of what could cause that blood, that breakage?
Part of it, there are different causes.
Okay.
One is somebody who has cardiovascular disease. Cardiovascular disease can be inherited or basically from diet. People who have high blood pressure. So those are some of the predisposing factors, is what we'll call them, that can lead to a stroke. So that's why they would advise you to minimize your salt, exercise, eat healthy, eat well, minimize the fat content of your diet, because what happens sometimes with cardiovascular disease is you get, the blood normally you have a vessel and the blood flows typically through it, but because of some of the stuff in our diet, plaque formation, that's the word. Things start to form on the inside of that tube and slowly narrow the tube. So the blood flow becomes difficult because that tubing is no longer smooth or the normal size.
Okay.
So that's normally what happens.
All right, so now stroke has happened, a physiotherapy started. Can someone have his or her life 100% after that time?
Yes and no. The beauty of the brain is that it has the ability to form collateral vessels and pathways. So if part of the brain is affected, I think I talked about that last week, that you can teach the person how to do something else because the brain has that ability. The brain basically controls both sides of your body. The left side of the brain controls the right side of your body, and the right side of the brain controls the left side of your body. So you can teach somebody what to do. The level of independence they will regain, like you said, can they go back to normal, really is dependent on the degree of the stroke. Okay. Somebody who has a very severe one may not have as good a chance as resuming normal function as somebody who has a mild stroke. So they come in degrees.
So where does the care that is given during physiotherapy or the level of care, when I'm maybe talking about the expert level of care, where does that come in? Doesn't it also have a part to play?
Yes. When somebody has a stroke, and just for information, strokes are not just happening with the elderly as we look at it. Babies and kids also can have strokes, and people don't realize that. A baby can be born, maybe during the birth process, can have a stroke. So we do see strokes in children as well as in adults. And the critical thing with that is that rehab needs to start immediately. The quicker it starts, the better your prognosis. That's the word that we would use, that the level that you can improve. Your chances are higher if you start early.
Okay, now how about somebody who's at home who maybe, after getting some care, what kind of activities can they try to do, or what should they limit after having a stroke or something?
Really, you shouldn't limit your daily activities. When you have a stroke, hopefully you would have had therapy right from the onset, and therapy involves trying to get you out of bed, trying to get you to sit up, trying to get you to walk. You shouldn't stay in bed. And I think that's a mistake some people make, that they keep their family members in bed because they've had a stroke, they need to recover. They need to be up and going. Those first 3 or 4 months are very important to get you back on your feet, as within, like I said, based on the degree of the stroke, but that time is very critical. But you can continue to improve a year or 2 years later, but obviously the improvement is not going to be as rapid or as fast or as much as the longer it is.
Now, apart from physical therapy, is there some sort of medication that could go alongside it? Well,
there's no one pill. Each person, anybody that has a stroke has other issues going on, other health issues. So whatever medications they're on for those things need to continue. So if somebody has high blood pressure, for example, they need to be able to continue taking their blood pressure medication. Because if not, the blood pressure will continue to rise and they can have another stroke.
You can have a second one?
Yes.
Even...
It's not a one-time deal. So if you don't wake up and smell the coffee, as they say, and do the right things, then yes, people can have a stroke again because you haven't done...
And then, of course, that's going to be even much more damage and all of that.
Exactly.
Doctor, it's always revealing. It's always wonderful talking to you. And, yeah, I hope somebody has learned something. And like I said, this is something that I try my best. So to prevent as much physical exercise does help.
Yes. Yeah? Good eating habits.
Good eating habits. You have mentioned that. That cannot be overstated. I reduced salt. I was boiling rice yesterday. I just suddenly dropped this. I said, guy, do you really need this salt? You need to think about it. So now I will just take out the salt entirely. Maybe the salt I've taken before can suffice moving forward. Thank you so much, Doctor.
You're very welcome.
Right, it's always a pleasure. Just stay tuned every Tuesday, of course, until the end of the month. Doctor will always be here to talk to you about physiotherapy. We'll take a time out now. Don't go anywhere. The show is on.